All right, we're gonna get set up for a Spyglass procedure. So the first thing we're gonna wanna check and make sure is that we have saline as our irrigation for the procedure. And because we're doing an ERCP, you're also gonna wanna make sure you have irrigation pump tubing connected, because that's not always connected during ERCP. Once we have saline connected, we're gonna reach around the back of the EHL console. There's a toggle switch. Turn EHL on, push the power button on Spyglass until you get your green dot here. Once you have your green dot here, you can come up to the Olympus processor and hit the Custom 1 button. Custom 1 will turn on picture-in-picture, and when you look at your monitor, you should see the Boston Scientific logo. As you toggle through Custom 1, it'll change the size and configuration of your image on the screen. The next thing we're going to do is, in this cabinet, we're going to find a box that says do not throw away. Inside that box you'll find two cables. The first one is the black foot pedal for the EHL console. That is going to plug directly into the left side. Now our foot pedal is activated, and then we have this vanilla colored extender cable. There's a little green mark on top of it, green mark facing up. We're gonna push that in, that twists and clicks in, and now our extender cable is ready to go too. Also inside this cabinet, you're gonna grab a Spyglass box. Once you've opened that Spyglass box, you'll find your Spyglass catheter. We're gonna connect the Y port to the biopsy port of the Spyglass catheter. The white end of the catheter with blue arrow facing up is going to plug directly into the Spyglass console. Until you hear a click, you know you will have done it correctly when you see the light come on at the tip of the Spyglass catheter. There's two ports on the side of the Spyglass catheter. One has water droplets. This is where you will connect your irrigation pump tubing directly to here. And then your irrigation foot pedal that you use for colonoscopy will control irrigation through Spyglass. The second port is for suction, but not traditional suction. So likely the best thing to do with this port is to turn the stopcock into the closed position. Unless the physician wants to irrigate through Spyglass, they can open it. You can attach a 20 or 30 cc syringe and you can suction out aspirate from the bile duct. The next thing we're going to do is remove our Spyglass catheter from the hula hoop. We want to make sure that there's no loops in our Spyglass catheter before we hand it to the physician. So make sure that it's nice and straight. Finally, your Spyglass catheter is going to be attached to the duodenoscope. Ideally what you want is you want the dials of Spyglass to be in line with the dials of the duodenoscope. And what we're going to do is go directly below the biopsy port as far as like height location on the scope. We're going to pull this blue tab out and away from the handle and then wrap it around, lock it on the scope. And then the guide wire we have exiting our biopsy cap is going to be fed into the largest working hole in the tip of the Spyglass catheter. It's going to follow that wire down into our duodenoscope. Our physician's going to advance it, and eventually our guide wire will actually come out the biopsy port of the Spyglass controller. The last thing is, prior to your physician getting in position, advancing the EHL probe, our normal setting is 15 shots on high. When the physician is ready to utilize the probe, we're gonna have to hit the play button. But our play button isn't gonna work until we've connected our EHL probe. EHL probes are also found inside this cabinet. You'll pull the probe out, remove that paper clip. This probe is just gonna pull all the way out. And then that probe, there's a little arrow on there. That's going to plug directly into the green portion of our extender cable. Now you see the EHL console has gone green to standby, and as soon as you hit play, it's activated and ready to use. When they push the foot pedal, the probe will activate. And that should help you be set up for your next Spyglass procedure.